Every day, something dramatic happens in the Caribbean that affects our lives. We'll give you the details. We'll give you the facts on Caribbean Perspective with Eddie Frederick. Host Eddie Frederick.
So glad you can join us. The OECS is admonished to make primary health care a priority. This story takes the lead in today's edition of Caribbean Perspective for Monday, May 1st, 2023. Details when we return.
Hubbard's Multi-Department Mount Gay and Hubbard's Tire Bay, located at the Building Supplies Compound in Grand Anse, are reminding the motoring public that another round for licensing and inspection has begun. Just arrived on new shipments of quality furrowed and torque tires to fit all makes and models of vehicles at competitive pricing. Shop early to avoid the hassle of long lines. WhatsApp them on 473-405-5482. Hubbard's, quality service, affordable prices.
Welcome back. One of the key issues that the OECS sub-region must tackle is that of creating a higher level of effective primary health care. Health, as it relates to the growth and resilience of our people and economies, was the main focus of the 7th Annual Growth and Resilience Dialogue of the Eastern Caribbean Central Bank and its partners. Glenn Bart of SKN Newsline reports.
According to ECCB Governor Timothy Antoine, investing in primary health care in the sub-region is critical for long-term economic sustainability and a stronger human capital base.
As a region, we must invest in primary health care to save lives and livelihoods. Indeed, that is productive for our families, for our public finances, our foreign reserves, and our economy. And I want to be very clear. In investing in primary health care, we have to invest in diagnostic facilities to support early detection and treatment, but we must also, of necessity, and this is important, take personal responsibility for our health. That includes healthy eating, active lifestyles, and a commitment, a culture of checkups, medical checkups. Too often, we resist doing these medical checks, and I'm happy that the prize is a medical check. And some of you would say, give me the money in my hand. Well, your health is more important than money at this point. Because too often we defer and we delay. And many times when we do it, it's only because our women, our wives, our partners, our mothers insist that we go to the doctor and get checked. And far too often when we finally arrive at the doctor's door, stage 1, stage 2, stage 3, stage 4, and then we are going on with a bowl in our hand trying to raise money for our stage 4 situation. It breaks my heart. It breaks my heart to see this happen over and over again in our member countries. And therefore, the culture of taking personal responsibility also has to be spoken of, even as our governments invest in primary health care.
The governor expressed the view that the sub-region must work diligently to uplift itself and build a better future. Glenn Bart reporting for SK Newsline.
Swine flu H1N1 virus detected in Jamaica. No need for alarm. TVJ's Jamila Maitland reports.
The Southern Regional Health Authority says it's closely monitoring a patient who tested positive for the H1N1 virus, but they insist there's no need for any alarm. Regional Technical Director at the SRHA, Dr. Vitilius Holder, says the patient was tested after showing up to the Mandeville Hospital with respiratory symptoms.
Since the pandemic, the virus has been circulating in the country, and the surveillance system has indicated that we've been seeing occasional cases of this. So therefore, persons with a diagnosis of H1N1 is not anything to be alarmed about at this time.
She explained that it's not uncommon to develop swine flu as respiratory illnesses have increased over the past couple months. What is uncommon, however, is that it's often detected in September, which is the peak season for respiratory illnesses. But Dr. Holder says early detection and treatment is key. Flu vaccines are also available, usually for healthcare officials and those with underlying issues. But the health ministry reported take-up has been low.
Within that influenza vaccine, H3N2 as well as H1N1 are the components of those. And so therefore, internationally, we have put it in vaccines just to ensure that persons, if you are at risk of any complications or so on, that we do have it.
The last reported case of swine flu in Jamaica was in January 2016. Before then, it was in 2011, a year after the H1N1 flu pandemic. During that period, several people died from the virus in Jamaica. The regional technical director says by practicing regular hand hygiene and applying the COVID-19 measures, people can reduce the risk and rate of transmission.
We have a tendency, once the numbers in any disease go down, we tend to relax, but the aim should be, we have learned that respiratory hygiene is pretty important. So I think moving forward, persons should just continue and not drop. And I think we need to look at how we can make the health promoting habits fun or something that you look forward to. So since this will always be with us, let us just continue to do these so as to reduce our risk, because the diseases are there and we just need to learn from these experiences.
Jamila Maitland, TVJ News.
Renata Burnett reports that during their press conference, a partnership for national unity remained firm in their assertion that they had alerted the Guyana Elections Commission, GCOM, about reports of forgery. However, GCOM chairperson Claudette Singh stated that she has no evidence supporting these claims.
Claudette Singh cannot and should not be saying it is disingenuous for her to be saying that she doesn't know about these complaints. They're lodged at the RO's office. We're also dealing with these complaints at the commission level.
That was Member of Parliament Sherwin Holder at the opposition's weekly press conference on Thursday, responding to claims made by Guyana Elections Commission, GCOM Chair Justice Retired Claudette Singh, that the opposition has yet to provide evidence of electoral fraud. The reports of fraud during the local government elections were brought to the attention of the Commission. Therefore, it is absurd for the chairman of GCOM to take that position, said MP Amanza Walton Desir.
The CEO has said in the public space that they cannot pronounce on these allegations of fraud, mean that they are aware. So our commissioners have brought it to their attention, and they are very well aware of it.
Vince Roy Jordan, Member of Parliament, said several reports have been made to the police regarding the matter of fraud. He added that the leader of the opposition, Aubrey Norton, even wrote to the Commissioner of Police, Clifton Hicken, to schedule a meeting, but to no avail.
Since the reports were made to the police, we have not received any word from the police at this time, and they have not followed up in any way with regards to those reports.
GCOM chairperson Justice Retired Claudette Singh, when asked about these claims and the opposition protests that have accompanied the claims, Singh noted that despite these allegations, no one has so far come forward and presented any evidence to GCOM. She said, and I quote, "They have not brought their evidence. When they bring the evidence to us, we will take it from there. But I have not seen anything. They're making allegations. Allegations are not evidence," unquote. Renata Burnett reporting for the HGP Nightly News.
You're listening to Caribbean Perspective with Eddie Frederick.
St. Lucia's Prime Minister Philip J. Pear on Thursday sought to spell out the rationale behind government's 2.5% health and security levy. The new levy was announced by the Prime Minister in his budget address on Tuesday and drew quick criticism. It seeks to channel funds towards improving healthcare and national security and takes effect in July of this year.
Prime Minister Philip J. Pear, in response to public criticism about the 2.5% health and security levy outlined in his budget address, further explained to reporters outside of Parliament on Thursday why the levy should not be misconstrued for an increase in the value-added tax. The Prime Minister further emphasized that food and medicinal items have been exempt from this levy.
I was clear. There is a health and security levy of 2.5% on goods except food, medicines, medical equipment, and there's a removal of the 12.5% VAT on building materials, which I listed. We have to go back to Parliament to change the law, particularly the VAT law. So when you go into Parliament, before July the 3rd, there's going to be a full and a complete list of what I said in Parliament.
Prime Minister Pierre insists that most of the criticism about this levy is coming from the opposition United Workers' Party, as he asserted that the 2.5% levy will have a significant impact on the various challenges currently plaguing the sectors of health and national security.
The levy is a health and security levy which will be used for health and security issues. And remember, note, I did not say a black box. Let me tell you why, if I was the opposition, I would be annoyed. I would be annoyed if I spent 5 years in government, I didn't get one hotel built. If I spent 5 years in government, I found a country where I spent $300,000 on a building and it never got complete. If I was the opposition and I signed an airport, I gave a contract for a direct award contract, an airport that will cost the country $1 billion. I would be very annoyed. So I am happy that they're annoyed. They have to be annoyed. If I were there, I would be annoyed also.
Further pronouncements on the 2.5% health and security levy, as well as the VAT-exempt construction materials, will be made in the coming weeks. For the TBS News World, Jason Darius reporting.
The U.S. Ambassador to Trinidad and Tobago, Candice Bond, says her country is working hard to stop the flow of illegal firearms to the Caribbean. TTT's Terrian Brown Campbell has the story.
The United States is committed to halting the illicit trafficking of firearms from its shores into the Caribbean region. This is according to U.S. Ambassador Candice Bond. Ambassador Bond was speaking to representatives from CARICOM and the Dominican Republic, who are attending a 3-day Caribbean Basin Security Initiative meeting on preventing the illicit trafficking of firearms.
Our commitment to stemming the illicit trafficking of firearms from the United States can be seen in landmark legislation recently passed and enforced to prevent gun violence and strengthen border security. President Biden signed the bipartisan Safer Communities Act on June 25, 2022.
The ambassador noted this law makes the trafficking in firearms and the use of false identities to purchase guns and ammunition a U.S. federal crime.
And through the bipartisan infrastructure law, the U.S. Congress allocated $3.4 billion to modernize ports of entry on U.S. northern and southern borders, supporting increased border security efforts and enhancing information sharing on illicit firearms trafficking.
She also highlighted that through the Caribbean Basin Security Initiative, the U.S. has invested over $832 million in the Caribbean to reduce illicit firearms trafficking, increase public safety and security, as well as promote social justice. The 3-day regional meeting ended on Thursday. Terrian Brown Campbell, TTT News.
In the meantime, Trinidad's Prime Minister, Dr. Keith Rowley, is blanking Gary Griffiths' offer to help arrest the crime situation in the country. While opposition leader Kamla Persad-Bissessar said she's open to the move, Dr. Keith Rowley shut it down and stood by his National Security Minister. During Parliament on Friday, Fitzgerald Hines noted that a recent police anti-crime plan could make a dent. Here is more from Jesse Ramdeo of CNC3 News.
On the back of a $1.5 million CARICOM crime symposium and a thrust to adopt several measures to combat crime, Prime Minister Dr. Keith Rowley is sidestepping a latest offer to join arms in the battle.
As chairman of the National Security Council of Trinidad and Tobago, I have very good reasons not to meet with Gary Griffith under any circumstances.
As he blanked the former top cop's request to assist in crime with killings barreling towards 200, Rowley again backed his National Security Minister. In his response to questions in Parliament about rising crime in Cunupia, Fitzgerald Hines admitted his distress swept across the country and not an isolated area. Pressed by the public, Hines' hope now hung in the police service's recent strategic plan.
A violent crime reduction plan, which was brought to my attention and of which I have a copy, built on the following golden pillars: precision, intelligence, prevention, proactivity, and prosecution.
Hines said the initiative targeted 15 objectives to achieve outcomes that have been topping the nation's wish list.
A 20% reduction of homicides and a 30% detection rate for homicides. as set out in the Violent Crime Reduction Plan.
Police Commissioner Earl Howard Christopher previously announced that anti-crime plans were expected to yield an end to the bloodletting by June. The National Security Minister also noted that the authorities have embarked on the installation of 2,500 CCTV cameras that can deter crime through detection. Jesse Ramdale, CNC3 News.
Hubbard's is once again innovating the way you shop with its new online store, providing 24-hour shopping convenience. You can shop now for appliances, hardware, houseware, building material, and more. Free delivery island-wide. Start shopping now at hubbardshardware.gd. Safe, convenient, reliable.
I am Eddie Frederick. This has been Caribbean Perspective, a whole new approach to highlighting developments in the Caribbean. In the meantime, please continue to log on to CaribbeanPerspective.com for more daily news and more.